you open the door to talk about depression. Now, recently, I don't know if you're aware, but recently, Snoop Dogg's daughter, Corey Brodus, was admitted to a psychiatric facility because she unfortunately attempted suicide due to her depression from many things. Some of the things that we talked about, the fact that she felt that she didn't fit in with her surroundings. Obviously, you know, her father being a celebrity and having money, she felt like she was a victim of colorism, where she felt because her skin was darker, that she wasn't seen as beautiful. She also suffers with lupus. And so we know, you and I know, that lupus can have some psychological issues outside of just the fact that you're dealing with any chronic disease, especially an autoimmune disease, just because you sometimes can feel like it's what's wrong with me, just that feeling like it's in my DNA that I'm messed up. So she was dealing with all those things. And then, you know, unfortunately, Googled, I guess you can find a lot of stuff on Google these days, Googled how to overdose. And prayerfully and gratefully, she sent a note. She sent goodbyes, final goodbye to her family. And it was her aunt that called her. And when her aunt called her, she didn't want to pick up the phone, but because she loved this particular aunt, she picked up the phone. And her aunt asked her, "What's going on? Where are you?" And so she finally did end up giving the room number where she was. And then the paramedics came and all of that. Now, with that, she did end up getting admitted to a psychiatric facility. And so that's usually where my part ends. I usually, in Florida, it's called a Baker Act here in Florida. So whenever you're admitted to the hospital with thoughts of suicide, especially if there's been an attempted suicide, we will hold you against your will, because we want to make sure that you're safe. Now, once medically you're stable, then I say, okay, it's okay to arrange for you to be inpatient at a psychiatric facility where, sir, you would probably then take over. Talk to us about depression, particularly that leads to suicide, and then what happens once somebody gets to a psychiatric facility, because that was something I thought was very keen that she talked about. She said that she knew to lie. She knew to say that I wasn't trying to kill myself. I was just sad. I was just trying to sleep. I wasn't. But then she then came on social media and said, no, I was trying to kill myself. So talk about once either self-help fails, maybe medications fail with depression, and then you find somebody within a psychiatric unit. What are the goals of inpatient therapy? And then how can friends, family be supportive?
Okay. Yeah. So I might be lengthy. I'm gonna give a heads up. I might be lengthy, but there's
for it. This is what we're here for.
A lot of good nuggets here. So first, depression. So here's some common symptoms that I look for in depressed patients. One, first, they have a depressed mood. And then some of the things I look for is sleep disturbances. Are they're sleeping too much or sleeping too less? So that's one of the things I look for. Then I evaluate in regards to their appetite. Are they eating too much, or they're eating too much, which is more weight gain or weight loss? So that's those two different spectrums I look at. I mentioned earlier about concentration. A lot of patients complain of difficulty concentrating. Some patients may complain of fatigue, low energy. A patient may say they feel guilty, worthless, hopeless, a sense of emptiness. So that's something I'm always looking for. Then are they you notice like physically if they're talking more slower? There's some things I have to look at their mannerisms, like where they're like we call psychomotor retardation, the way they're moving or talking very like is this like
very retarded? Yeah.
So those are some things that I look for. Then the big one, the suicidal thoughts. Are they thinking about like killing themselves? Is the thought of suicide just constantly playing in their mind? There's some patients that don't want to act on it, and it drives them crazy that they're thinking about suicide because they have family members. And so a lot of them tell me that they have these thoughts, but they don't want to do anything. They don't want to act on it. They just want it to stop. And so, but there's others that their depression is so severe that they want to end their lives and end their pain. So in general, Yeah, that's what I deal with a lot of patients that are struggling with depression. And I do talk to them about treatment options. There's therapy, they could see a therapist, or if I could also provide therapy with them as well in regards to their depression. Then there's medication management, where I could treat them with antidepressants, a mood stabilizer, or antipsychotic, because there are people who have depression that can hear voices based off their depression, and so we do treat with that. And then there's also non-medical ways to treat them, like I mentioned, therapy. And then there's new technologies such as transcranial magnetic stimulation, which helps with treating depression. Then there's ketamine, there's an off-label ketamine infusion, and then there's one that's FDA approved with the Spravato is like a nasal S-ketamine spray, which helps with depression. And there's different modalities in treat, and also electric convulsive therapy, ECT. So that's more like they do it inpatient in the hospital.
Mhm.
And so those are the different ways to treat depression. So now